Welcome back to CBS Mornings. Now, we've got a lot more on the threat of a worsening tripledemic this winter. The CDC says hospitalizations for RSV and the flu are starting to decline, but health experts predict infections for COVID and these other viruses will jump as a result of holiday celebrations and travel. Dr. William Schaffner is an infectious disease specialist at Vanderbilt University Medical Center in Nashville, and he joins us now. Good morning, doctor.
Good morning. Good to be with you.
Good to be with you. So of the three viruses, COVID, RSV, and the flu, which has you most concerned? And more importantly, what can people do to protect themselves?
Well, at the moment, I'm most concerned about flu because although the CDC says that cases have diminished in many parts of the country, that was before the holidays. And we have New Year's coming up. So I anticipate that with all of the travel, all of the confusion, all the joyous reunions over the holidays, there will be many opportunities for this virus, this influenza virus, to be transmitted and spread even further. So I anticipate that we are going to have a post-holiday surge for sure.
Dr. Schaffner, we've been talking a lot about the shortage in children's medicine. I have friends of mine who are calling each other saying, I found some Tylenol here, do you need some? What should parents do right now?
I think talk to their pediatricians. These medications are for symptomatic relief, so it's not as though their children are going to get worse in any way, but the pediatricians can sometimes help them adapt adult medication for pediatric use. But you want to talk to your doctor because you want the dose to be right, depending upon the size of your child.
Dr. Schaffner, there has also been strep A infections that have killed at least 2 children in the U.S. and even more in Europe. What else do we know about this?
So root A strep is that bug that, of course, causes sore throat. But occasionally, when a virus has inflamed the back of the throat, the nose, and the bronchial tubes, these throat bacteria can get through the protection of the mucous membranes and get into the bloodstream, causing more serious infections. Parents, if your children look in any way ill, they're having any difficulty, please contact your healthcare provider. We can treat these infections very successfully.
So, doctor, let me ask you to speculate a bit here. When might we see this ripple effect from all of these infections? In other words, when we look to the new year, at about what time will we see a lot of Americans that are sick from these infections that are happening because of travel and celebrations?
Well, sometime already this week because of all the Christmas and other travel. And then, of course, after the New Year's because of all of those New Year parties getting together. So the week after and 2 weeks after New Year's, we anticipate that we'll see an increase again in many of these respiratory infections, including the common cold, COVID, perhaps RSV kicking back up again, and for sure, influenza. So particularly people who are older, who are frail, have underlying illnesses, are immune compromised, and if you're pregnant, if you're going out in crowds, still wear that mask. And remember, it's not too late to get vaccinated.
I love that PSA. Dr. Schaffner, speaking of vaccinations and COVID, it's estimated that 95% of Americans have COVID antibodies. Does that mean that this winter season is going to be a little bit less severe in terms of COVID, hopefully?
Oh, yes, I think that that's the case. We're not going to have a surge the way we did last year and the year before. But remember, COVID is still out there causing the death of somewhere around 300 Americans every single day. If we hadn't had the surge before, we would all be very excited about that. So it's still a nasty virus out there. If you haven't received the updated COVID booster, please don't linger. Get it as soon as possible.
300 American deaths a day. Dr. William Schaffner, thank you so much.